Yeah. Okay. All right. I think I'm in. Can you see me, Linda?
I can. Hi.
Hey, beautiful. How are you?
Good.
Oh, sorry about that. We're having some technical difficulties
Well,
this morning, but
did
we're
I.
getting it straightened out. Great job.
Yeah, I had some too. I was like clicking. I'm like, it's not working, but
It's working great.
I'm glad it's working. Thank you so much for coming on. Thank you so much for coming on today. I appreciate you.
Absolutely. I do anything for my sister girlfriend here.
Okay, well, yeah, Mom said a lot about you, so I'm glad that you're able to come on. You look amazing.
Thank you.
It's so beautiful, Linda. Well, Linda, this is called the Buckle Up Podcast Universe. And we have over
3 million.
Well, we hit 3 million.
Yeah, 3.4 million viewers and listeners around in 7 countries so far.
So we're doing all right with the Buckle Up Podcast. But today, this is about you. And so we want to hear how you got into nursing, how you started, where you're from. So if you don't mind telling us where you're from a little bit, how long you've been where, and then how you became a nurse, that process, okay?
Absolutely. Well, my name is Linda, and I've been in nursing for over 20 years. I started as a medical assistant, and then I went back to school, got my RN, got my BSN, and just kind of transitioned from the office side because where I was working, it was a gastroenterologist's office, so I worked closely with the endoscopy unit. So when I graduated, they automatically hired me, which was God's blessing because it's hard to get into the endoscopy unit because it is a specialty. So I was there. Then I took on travel nursing, which brought me to where I am now, Northern Virginia, and I'm at Inova Hospital, which is a trauma 1 level hospital. And so I'm loving it. It's a great specialty.
Well, Miss Linda, I'm gonna have you back up a little bit here because I appreciate everything you said was great. Would you mind going a little bit into how what made you think to go into? You said you're in the administrative side, but then you went back to school. If you wouldn't mind mentioning that, actually, that whole entire process would be great, and you have the time to mention it too.
Yeah, absolutely. So you want to tell you that now?
Yes, ma'am.
Yeah.
Yeah. So I've just always been a people person. I love people. And where I was working with patients, but I wasn't getting that fulfillment of being able to like help people and, get them. What we do now is we do such a wide variety of things we see. Not only am I doing endoscopy, but also interventional pulmonology. So just being on that side where I can be more with the patients, I can take better care of the patients. The administrative side was more like setting up the colonoscopies and getting everything scheduled, making sure the doctor was on schedule, things like that, but not really being able to take care of that patient.
Yes, ma'am.
And the good thing about what I do is, as a floor nurse, you have a patient maybe for 6, 7, 8 a month. It's really not certain. But with my specialty, they come in, you take care of them like for that day. So you get to go through that whole process and get them and let them go home, which is great.
Yes, ma'am. Okay, that's absolutely amazing. So for you to go and get your, I think you said your RN and your BSN. Did I hear that correctly? Or did I hear that wrong?
Yes.
Where did you go to school for that, or how did you go about doing that? Because we have this thing called Buckle Up University. So you're basically explaining to an 18-year-old kid right now who is thinking about maybe going in, following in your footsteps. So I say we have everyone break it down, basically how you did what you did, if you don't mind.
Yes, and not only for an 18-year-old, but for a 55-year-old,
okay,
65-year-old. So I went back to school at 55.
Oh, wow.
Linda, you don't look that age at all.
I got my RN, and just 2-3 years ago, I got my BSN.
Okay.
So yeah, I mean, it's just the process of, when you decide this is the path you want to go on. It's good to do research on certain schools. I did an accelerated program. Also, other programs you can do through, universities, which are 4 years. Mine was 18 months.
Okay.
While I worked full time and did school at the same time, but got my RN. And like I said, you can go through the process of doing an accelerated program and get your RN where you can start practicing.
Yes, ma'am.
Then decide to go back to school and get your BSN. Or you can stay in that 4 years and do your BSN. For me, it was because of age and because of time, I just wanted to start practicing as a registered nurse. And then went back and did my BSN later. So it just depends on what path you want to go on. But once you get into a nursing school and you start in your field, it's so many branches you can go in. You don't have to work on the floor necessarily. You don't have to work in a hospital. You can do insurance companies, you can do informatics, you can do forensic nursing. It's just such a wide branch of things you can do.
Oh wow, that's absolutely amazing. Thank you so much for breaking it down like that. If you also don't mind me asking, at you don't have to say you don't have to mention your age again, but when you started, I think you said you're around in your 50s when you started. What was that? What was that like for you? Were you intimidated? Were you, guys got my back?
Absolutely. I was in class with 20-year-olds.
Oh yeah.
I just feel like I'm not a school person. I feel like that most of the time, but you get with a good study group and you just kind of push your way through it. It just goes so fast because you're always working, you're always studying. I mean, it's just constant go, go, go.
Yes, ma'am.
So by the time you realize that you're at the end of the program.
And that was 18 months, right?
For me, yes.
That's super fast. You said that was accelerated program.
Accelerated program.
And imagine, well, listeners and everybody, I want you to know about the friendship Linda and I have. I first started selling medicines for a pharmaceutical company out of Delaware, and I was selling a gastroenterology product, reflux medication. I'll just put it in that class, reflux medication. And I'll never forget meeting Linda. Linda was so caring, so kind to me, made me feel at home. Linda, I think you were probably my third office I had gone into. So, of course, I was really nervous. But you made me feel so at home with that bright smile and getting a chance to know everybody in the office and all the different units, because you work for one of the largest practices. Is that correct? Tell me about that large practice and how many gastroenterologists you had that add in that practice.
It's called gastrointestinal specialist. It's out of Richmond. At the current time, I think they have over 20 doctors.
Oh, wow.
When I was there, they probably had about 12.
Okay.
12 to 15 doctors, but it is a large practice. And, it's just a great place if you're in the Richmond area, to go get your colonoscopy done, because that's what we do.
Yes, ma'am.
Well, Linda, I think it's also amazing for people to know that you have two sons. And when you were going to school, you had sons.
Yes.
Tell us a little bit about that process of being a mother and trying to keep your young guys on the straight and narrow, and they're beautiful sons. Tell us about that process of mother and studying to be that and working.
Well, fortunately for me, when I went back to school, my sons were already in college.
Okay.
So, but working full time and trying to go to school, it is a task. So I worked 8 to 5, and then I would go to school from 6 to 10, 11 o'clock at night. And that was almost every day of the week. So just trying to get my study in where I could. I would leave from work. Every time I would leave, I would put on a lecture, because I recorded all my lectures. Anywhere I went, if I went to Walmart or if I went to the grocery store, I would pop in my lecture and I would just listen to, and that's what I did constantly. Going out was not a thing I could do at the time. So I just said, okay, you're gonna buckle down, you'll get this done. You can go dance and do whatever later, but right now my focus was getting that degree. So.
Oh, excellent.
Yes, ma'am.
Tell me one thing. How do you go about educating patients, especially when it comes to prepping for the colonoscopy? Because a lot of people are listening to that, and we're dealing with some friends with colon cancer, but prepping for that whole procedure.
Yeah. So first, just let me say that colon cancer is the number 2 leading cause of death in the United States. Lung cancer is number 1. But it is the most preventable cancer as well. So if you're doing the things you need to do to prevent colon cancer, which includes a healthy diet, not smoking, limiting your alcohol, getting a lot of fiber in your diet, whether it's through fruit or vegetables or sometimes supplements. But I always think that getting it in through your food is the best way. And, we can go over a list of things like that. But prepping for the colonoscopy, I think a lot of people don't get a colonoscopy because they're afraid of doing the prep.
Mhm.
So, and if you talk to anybody, they tell you you're gonna have this big gallon jug that you got to get down, which is basically true. But they do have several types of preps you can do. One is like maybe 2 liters. I'm not sure how big it is, but it's 2 bottles that you drink. The other one is the gallon jug. And then there's a Miralax prep you can take. Like you can mix it with ginger ale or you can just mix it with water and it's tasteless. But no matter which prep you do, you're going to have to get the volume in. So the day before, you're going to be on clear liquids all day. And the important thing is that you make sure you stick to that clear liquid diet because remember, whatever you're putting in has got to come out, right?
Yeah.
Mhm, mhm.
So some people will even do a 2-day clear liquid diet. But you do your clear liquid diet, you start drinking your prep the evening before, you drink that throughout the evening. A lot of doctors now do a split prep because they feel like the patients get cleaned out a little bit better if they do half of it the day before and the other half the morning of. But some people just want to get it down, so they'll do it that evening before.
Yes, ma'am.
And it's important to have that prep done because you don't want to go in and get your colonoscopy done and you're still dirty. And when
Yes.
I'm dirty, the doctors will say there's a lot of debris, which they can kind of wash out with the scope. But if there's still stool in there, you're going to miss polyps.
Oh, wow.
Oh.
So in that case, they would have you come back. If you come in with a dirty prep, they'll say, oh, well, it wasn't clean enough for me to see. Go home, clean out again and come back. And nobody wants to do that, right?
Yeah, absolutely. I have a question, unless you have something related to what you were saying. Is so you said that one of the ways, with people having colon cancer, how is it? I mean, how are we as men or women? How are you supposed to know that you're even? Because you said it's so preventable, but how are you supposed to even know if your doctor? Let's say if in your 30s and you tell your doctor, "Hey, doc, I want to go get a colonoscopy," and they're like, "Oh, well, you're not of the age." But I mean, we have a sad situation where like Chadwick Boseman died of colon cancer, and like what could have. I mean, they might have done everything they could, but like, how come that was missed, or how come people miss it?
Yeah. So depending on your insurance. Now, if you have a good insurance company and you go to your doctor and say, hey, I want to get a colonoscopy, they may let you do it.
Yes,
And
ma'am.
that's the bad thing with insurance companies is because they dictate what you can and can't have done, whether your doctor thinks you should have it or not.
Okay.
That's a whole nother thing that I could talk about forever. But if you go in, if you have a family history of colon cancer, if you have a family history, so if your mom had polyps and
Yes,
you go to your doctor and you say, hey, my mom has polyps, I want to get a colonoscopy, most likely your insurance company is going to cover it and you can go get it done.
Okay.
If you have a family history of colon cancer and you're at 30 years old and you say, hey, I've been having this severe abdominal pain, or, I go in and my blood count is low, or I'm constipated, I can't go to the bathroom, or the caliber of your stools change. They go from being more firm to skinny.
Yes, ma'am.
You go in and you say, hey, these things are happening to me. You can definitely get a colonoscopy done.
Okay.
The recommended age right now is 45. It used to be 50 and they've lowered it to 45.
Yes, ma'am.
I think it should even be lower.
Yes, ma'am. I agree.
Because where I work now, we see children who have polyps.
Oh, wow.
Yeah.
And that's something I want you to really talk about, Linda, and about the children. And when you mentioned something to me about seeing kids with polyps, tell us a little bit about that and what happened, what shocked you in that process.
Yeah, well, let me just say one thing back to
Yes,
Brand. If you go in and you have a polyp, it's something that's easily taken off.
Okay.
So people who are nervous about getting a colonoscopy or don't want to do the prep, it is like one of the most simple tests you can have done.
Okay.
Once you get that prep in, everything else is just going in and taking a nap and getting it out. If they
Yes,
see a polyp, they can go in with an instrument through the scope. It's like a little lasso. They snare it, snip it off, and send it off to pathology.
Okay. Thank you so much for explaining that to me.
Yeah, and there are different types of polyps. If they go in and they see a polyp, it's called the hyperplastic polyp.
Mm-hmm.
It's more just like a little skin tag. Say you got like a little skin tag on your neck or something.
Mm-hmm.
A hyperplastic polyp is kind of like that.
Okay.
The second type of polyp you might see is a tubular adenoma, which is a precancerous polyp, but not necessarily has cancer. And then a villus adenoma, which can be more likely to have cancer in it.
Yes, ma'am.
Mm.
In any regard, they can take all of those off. So if they found a skin tag, more like a hyperplastic polyp, you don't have to come back for 10 years.
Okay.
If it's an adenoma, you're 3 to 5 years to come back because those are precancerous polyps.
Oh,
But
wow.
the good thing is if they take those out, then they're gone.
Yes, ma'am.
Mhm.
So you may not ever have another polyp, or you might be, I mean, we see people who get polyps out and come back in 3 years and they got 4 or 5 more polyps in there.
Holy smokes.
Mm.
Yeah.
Mm.
But they, like I said, you go in, get them taken out and you're good.
Yes, ma'am.
And that's why they say it's the most preventable cancer, because if you just go get your colonoscopy done,
Yes, ma'am.
this can all be taken care of on the front side. If it stays in there and it's not taken out, it will turn into a cancer.
Yes, ma'am.
Mhm.
Oh, man. Thank you for the
Wow.
knowledge. That's what we needed to hear
Yeah.
you say.
One thing before we get to the kids, I did want to say something. I remember doing a preceptorship with 3 doctors in your whole group. And I saw the invasive nature of doing the screening. And I told the Lord, I said, Lord, you got to come up with something better than that for me. And sure enough, they came with this product called Cologuard. And I remember the insurance company did not want to do pay for Cologuard for me initially, but I called. I had discussions from the person who first answered the phone all the way up to the top person, and finally they agreed to let me do the Cologuard process, which is wonderful. So tell me how that fits in now with the way you all conduct the colonoscopies versus the Cologuard, and how that process works.
So the Cologuard, is a DNA test. It's done through stool, and it detects whether or not you have a chance of having polyps or some type of cancer.
Mhm.
Most doctors prefer you to come in and get that colonoscopy done. For people who are older or people who may not have any like signs of any family history or anything like that, they may do the Cologuard,
Mhm.
which, like I said, it detects whether or not you might have it. So if you do it and it says, hey, Carolyn, you've got that DNA that says you might have a polyp. So you still have to come in and get that colonoscopy done, right?
Uh-huh.
On the flip side of that, you don't have anything and they say, well, you're 55 and you don't have any sign of anything in your DNA. It's like a 50-50 thing still, because it's not 100%. And
Right.
that Cologuard can still give you a false positive or a false negative.
Mhm.
So it's always best. And most doctors that I've talked to say it's best just to come in and get that colonoscopy done.
Okay. If you are of a certain age, but if you fall in the category of a 30-year-old, that Cologuard probably could be a precursor to the colonoscopy.
Yeah, it's in the DNA, yes.
Oh, great. Because I often wondered how you could look at the DNA when they took polyps out. The reason being, you remember the time you all came with the camera peel? It was a camera peel. Dr. Seaman showed me how that worked. And he said, Carolyn, you swallow this pill and goes down and takes pictures all along the way. Did you
So-
all find that to be a good method, or that was so expensive?
So what you're talking about is a video capsule.
Mm-hmm.
That is it's a pill and it's about the size of a fish oil tablet.
Mm-hmm.
When you open it, it has a blinking light on the top. It almost looks like something from outer space. That is really used to go through the small intestines because there's not a scope that can get to the small intestines.
Mm-hmm.
It is used to take pictures, and it takes thousands of pictures as it goes down to see if there's any type of bleed. And
Mm-hmm.
that's typically what we use that for, and not necessarily for a colonoscopy.
Oh, I got
To look at the small intestines.
Oh,
Yes, ma'am.
okay. That's
Wow,
interesting.
that's good to know this is all preventable.
Okay, yeah.
Yeah.
So let's go to now the children. That and diets and that kind of thing, but children first, what you've seen.
So I just started working with kids about 2 years ago. My practice has always been with big people. I call them big people. But we have seen so many children with polyps. Just yesterday, we took out probably about a polyp about that size in a 12-year-old. Polyps are tiny. So when we say polyps, people think, I don't know, sometimes people think you got something, I don't know, maybe like the end of this thing here, it's big, but it's really not, it's tiny. It's most of them are probably like you put your two fingers together, like what's right in the center there. That's basically about how big a polyp is. Some of them can be larger. But we've been seeing such an increase in children with these polyps. We had a 4-year-old. Like I said, we had a 12-year-old yesterday. But I feel like it's a lot in what the children are eating now and what we have in this country as far as food. Everything is processed. Everything has antibiotics in it. And so, because I can't remember ever seeing so many, I'm going back like 10, 15 years, of children having polyps like I'm seeing it now. Really scary because if you think about a 9-year-old that has a polyp, and if something else wasn't going on that the doctor didn't go in to find it, that's going to grow until they're 20, 30, 40 years old.
Wow.
By then, you're definitely going to have a cancer.
Yes, ma'am.
Oh my word, Linda. Ooh.
Yeah.
And you told me that one child you saw had a polyp about the size of a quarter.
Jeez.
And
Yeah.
you were, and I asked you that time, what made you do the colonoscopy on that child? And you said you were explaining something to me, and maybe the audience needs to know that.
Well, some of the kids we see have, like I said, we're level 1 hospital, so we see the sickest of sick people. A lot of the kids already have other things that are going on, whether it's malnutrition or they're having vomiting or diarrhea, or it's just something else that's been going on with that child, and that's typically how we find it.
Okay.
Oh, wow. That's so interesting. And I would wonder what parents are thinking now, because they're thinking, what can we do at this point? What could parents do to try to prevent anything like that happening? I know they might not be able to prevent it, but maybe they can do something, because you mentioned diet. So could you talk a little bit about that?
Just like I would tell an adult now, what we're eating, these kids are eating fast foods. They're eating this quick pop-up microwave stuff. I just feel like a lot of it is coming from the foods we eat. Getting lots of fresh fruits, fresh vegetables in your children, making sure they're getting water, exercise. My kids growing up were outside all the time. You don't see that with these kids now.
Yeah.
They're on games, they're on their phone, they're on their iPads, and not really getting any good exercise. So, exercise is important. Like I said, that diet is so important. Fresh fruits, berries, apples, pears, broccoli, things that are high in fiber. When you get a high fiber diet, you're going to have regular bowel movements.
Yes, ma'am.
When you don't have that, a lot of times you tend to strain, you're constipated, and that can cause something called diverticulosis, which are little pockets in the colon. They look like almost like little holes in your colon.
Okay.
And that really comes from straining when you go to the bathroom. So that's why you want to keep everything moving. And if those things become infected, then you got something called diverticulitis, which you don't want to have because it's very painful.
Yes, ma'am.
But yeah, so that's why it's just so important. Colon health, gut health in particular, just all around, mouth out, it's so important of what we're eating.
Miss Linda or Miss Bagby, I'm not sure what you prefer. But okay. One thing I think is I kind of see, I've seen it too, like where parents, I'm just an uncle. That's all I can say. I'm talking from an uncle perspective, but I think parents are maybe letting their kids get away with. Well, when I was coming up with mom and dad, we didn't have a choice what we ate. They fed it, and that's what you ate. But we turned out well. I think that now it seems a lot of parents are just letting their kids eat whatever, or maybe they don't have the time because of their job. But if they're letting their kids put this junk in and not doing anything, and then unfortunately the grandparents can't police the children because they're too scared that the children are going to get mad at them for trying to police the grandparent. But if someone speaks up and actually says, hey, look, your son's obese, your daughter's obese, this stuff is leading to, we have Miss Linda Bagby here who is seeing this firsthand. You got to change up now in order to prevent this from happening, because something could be going on with your child right now. And the last thing you want to have happen is a doctor come to you and say, hey, you know what? Your son or daughter has cancer. And well, what could I have done differently? Well, you could have listened to if the grandparents spoke up, if the parents had been parenting more and had actually said, hey, look, this is what you're going to eat. You're not going to be the boss of me. I'm the one that birthed you. This is what you're going to eat to do. I think there needs to be more of a stern hand, I think, in the way people, hold on a second, the way people are doing things these days, I believe.
I think it needs to start young. It needs
Yes,
to
ma'am.
start really young and develop that habit of eat. I have a granddaughter, and her mom is from Laos, which is close to the Philippines, I guess, Thailand. But they eat fresh food, like she eats vegetables. She loves fruits, and I mean just fresh berries, fresh. She eats avocado and just good things. So
Yeah.
I just feel like it needs to start young in kids.
Yes, ma'am.
Exactly.
So
Well, yeah, and some of the kids, excuse me, have you finished, Linda? What I wanted to say is that some of these children, the parents aren't home in the afternoons, and the children are trying to raise themselves. And I know it starts with education. It starts because we grew up. I don't like desserts that much to this day because of after we would eat dinner, all our vegetables and everything, we would have boxes of oranges and boxes of apples. And that happened to be desserts for us as a child. And so I'm just thinking that these little kids that are raising it, they call them what, latchkey kids in the evening, they come home and they open the door, they go in the house and they stay until a parent comes in to help. But your boys and I know in your refrigerator, when I would visit, you had the most healthy things to eat. Olive oil, you had that. I didn't see a bunch of junk in that refrigerator. Everything was just catered correctly for your diet. I want you to go into how your diet has played a part with you and as far as exercising, because you do teach some exercise class. So I want to go into that part now that we've gone through. Any more on the nursing side of it?
No, no, I think we're good right now.
Right now.
Okay. We can always have you back, Miss Linda.
Yeah, always, Linda.
Yes,
we want to go into, I don't know if Brandon knew you taught classes in the gym as well. So could you speak on that as well?
Yeah, well, I'm certified personal trainer, certified fitness instructor.
Okay.
Mm-hmm. I've been teaching since 1998, I think.
Okay.
Yeah.
Wow.
So I did the gym for a while, did American Family and Gold's Gym.
Okay.
And then I went out and I was doing personal training just out of my truck. I carried everything and would go to a couple of the doctors' wives wanted training. So, things like that.
Yes, ma'am.
Diet has always been important to me. I just feel like what you put in your body is what you are. So just trying to live a healthy lifestyle and we won't keep talking about my age, but 9, I did it's under the bodybuilding umbrella, but bikini competition.
Okay, wow, nice.
Yeah. So just going through that process of the diet, because I hired a personal trainer myself to do that.
Okay.
And I thought that I had a really good diet at the time and went to this trainer and said, okay, they said, write down everything you eat for the next 3 days. And so I did that and I took it to them and they looked at it and said, you know what, this is horrible. And I'm thinking, oh my gosh, it's great. But I wasn't getting enough protein in. So, and other things like that. So it's just important diet-wise, just to have a healthy body. And just going back to disease, you want to have things in your body that are going to help prevent inflammation and help decrease the chance of getting disease.
Yes, ma'am. Okay, so you're like the original Aunt Viv in the Everybody Dance Now video. Yeah. Yeah, you're exactly like that.
You can see how beautiful Linda is and how pretty her skin is and everything. And her arms defined. It's because she takes care of her body.
Yes, ma'am.
And at 55, forget it. You make the 30-year-old girls look like, wait a minute, don't you see she can keep up with us and surpass us. And I admire that, Linda. I admire that in you. And so ladies out there 55 and over, hey, it's time for us to get busy.
Absolutely. Miss Bagby, I wanted to see here. I think there was two things I wanted to hit. Sorry. Wait, so you mentioned personal, the places you mentioned that you worked at is funny because I went to some of those gyms. But so I used to be a huge obese kid, eating terribly. For the most part, I stay in great shape. When I'm in South Carolina, back home, I don't eat great, and I've seen the difference. I've seen literally where I've been the epitome of fitness since I was in high school, all the way through college. But even through like with all my career stuff, because I had to stay small. But I noticed in being home, I eat like I don't eat the best. Mom makes amazing meals, but I eat junk food that I shouldn't be eating, and I've noticed the difference. I'm like, hey, hold on a second, this weight's coming on all of a sudden, and that's for me making bad choices. But when you mentioned the fact that like with personal trainers and stuff, I'm not going to mention the gym that you were at, but I would go in there sometimes, and I would see that the personal trainer doesn't look like I believe you're going to get a product. I want that product to do that. If I want to get a pair of shoes, I want that shoes to be the top thing. I see personal trainers that were not in great shape.
Yes.
And not the product. And I see them training people who look like better in shape than they were. So I just found that interesting sometimes. Like I believe that you should preach I believe that you preach whatever you do, speak, you should preach. So I am who I am. Everything I speak, I do. I walk that walk. So I thought it was just interesting with personal trainers a lot of times to see them not looking necessarily the walk of the walk.
I've seen the exact same thing. And I've thought, just like you thought, she's training her, she needs to be. Yeah.
Yes, ma'am.
Linda, I tell you, I look at all you have done and accomplished in your life. You also always and will forever inspire me. You won't know how much that has meant to me over my life's journey, knowing you. And I think we've known each other a good, 20 years now, maybe. 20 years, yeah. And when I talk with you, you always have that upbeat personality. I see your smile, not looking at you. I know you're smiling through the phone. We're laughing through the phone. And that's what a person needs when they're going through life's ups and downs. A positive person as you are, and takes us through that part of life. Sometimes people say they need to see a doctor or talk with someone, a counselor. If you have a great friend like I've had in you, that's all you need to go through life's challenges. Now, tell me, you went to St. Lucia. Where did you go the other day? You went to another country.
St. Lucia?
St. Lucia is beautiful.
Okay.
Beautiful.
Oh, amazing. I think that's where the girl that won the 100 or 200 went. I think she's from St. Lucia. That's a blue and yellow black flag, maybe?
Yeah. Julian, what's her name? Alfred?
Oh, yes, ma'am. I think that's her. Yeah, she was amazing. She is amazing. She won the 100 and smoked everybody.
Race.
Yes, ma'am. In the Olympics. Sorry, I watched the Olympics.
Okay. All righty.
Yes, ma'am. Well, I'm glad that you had a good trip there. And then, so a final thing I just want to touch on with you real quick, if you wouldn't mind. And then you're welcome back anytime, just so you know. It's not just a one-time thing. With Cologuard, especially for younger people, could they just go ahead and do Cologuard? Because that might be the way to go if they're not going in for to get checked for polyps.
If your insurance company will cover it, yes. It's all with the insurance companies. Like if you want to pay out of pocket and you feel like you just want to know, but you just want to know.
Yes, ma'am.
They do it.
Yes, ma'am. Absolutely.
Oh, that's great.
Okay. Well, thank you so much. You've been absolutely wonderful. That's everything I had.
But last thing I wanted to say was,
go ahead.
So important to know your family history.
Yes, ma'am.
I mean, a lot of young people just don't know what their grandparents had or their grandparents' parents had. And that plays a big part in your health and what you get diagnosed with. So it's just important to know your family history.
Yes, ma'am. I think I know that I'm not getting too much into it, but I know on my dad's side of the family, there's a lot of stuff I had to look into because of it. So, definitely.
So I get tested young. Like these prostate cancers and all this stuff for these young men. It's just important for overall health, just to make sure you're seeing your doctor on a regular basis. Men have a hard time going to the doctor sometimes.
Yes, ma'am. No, you're absolutely right about that. It's like when my dad passed, that's when I started changing up completely everything. Because of the things I saw, and I knew that I was like, hey, I saw my dad, just touch on this for a second. I saw when my dad had cancer, I saw it about 1.5 years before he even knew what it was. I didn't know what it was either. I just went to my dad and said, hey, Dad, look, man, you're losing this weight. I work out all the time. I'm a healthy person. This isn't right. And so what's going on. And so unfortunately, it was misdiagnosed, which happens a lot of times. And but I just wish that we would have, I beat myself up about it sometimes, even though I shouldn't. But it's like, hey, I saw this back then, and that was probably when you were at stage 2 or stage 1 instead of when we catch it at stage 4.
Yeah, right, exactly. Well, it's great you have this platform that you can reach so many young men, because it's so important for, especially our Black men, to see other men who are spreading this word and, encouraging people to get to the doctors and get checked out. So
Yeah.
I applaud you on your platform.
Oh, thank you so much. I thank you for coming on. Mom's like, hey, we have to have Miss Linda Bagby on. So I'm like, or Linda Bagby. And I'm like, yeah, absolutely.
Well, one thing, Linda recently got engaged
Oh, congratulations.
to a beautiful guy
Hey, bling, bling, put a ring on it.
named Chris, and I'm glad everybody's seeing that. Men out there, she just recently got
Oh,
engaged
yeah.
to a beautiful man. His name is Chris.
Congratulations.
And he is going to come on and talk about a few things as well.
Okay.
Not today, but schedule a time with us because he has a story to tell.
Oh, I can't wait to hear it.
And I can't wait for him to share that with everyone, his journey. And so with that, Linda, I'll be calling you right after this call to get him on the books. The day we have a busy schedule, which is beautiful. We have a person at 1 and then someone at 3:30.
3 o'clock and then someone at 4:30.
So it's been great, but it's putting so much positive in the atmosphere. Words of encouragement out there, people learning people's stories, young people trying to decide what they want to do with his or her career, what steps they take. And so that's what this is all about. And we just thank you so much for coming on. You have one
Yes, ma'am. Miss Bagby, because we're going to touch on it because we have a subject about dating and all that kind of stuff and getting married. Here at your beautiful age, it's never too late, obviously, and it's the fact that you don't have to settle for just anybody, or that love can come back around again. So I think that you are a beautiful example of the fact that, hey, look, you're right now engaged, you're not worried about, you've lived your best life, you've raised 2 beautiful children, and you found love here. And so it's like, it's proof, and you started a second career, at the ripe age of greatness. And I just think that's amazing that you've managed to hit so many categories. You're a mom who raised these beautiful children. You have become an RN, BSN nurse. I think I said that right. And one of the most difficult units to get into, I believe. And then also you've found love now again, or for the first time, or whatever it may be. But it's never too late to start over.
Absolutely.
Yes, ma'am. That's what I had to say.
And the final question, I thought about this usually near the end, something comes to mind. You did traveling nursing.
Oh, yeah, that's right.
Why was it so important for you to take that step within your career?
Well, I just wanted to see what it was like to travel, to go to different places. And because with a travel nurse, you go work somewhere for 3 months. And then if you don't want to stay there, you go somewhere else.
Oh,
And so I used to call myself a gypsy nurse, just
Okay.
That's great for young people to hear that.
Yes, ma'am.
Yeah.
I love that. I happen to know a few travel nurses and travel RTs. So that's it sounds amazing. If I could go back, I probably would have loved to have done that.
Yes.
To be honest with you. So you've been wonderful, Miss Linda Bagby. I appreciate you so much for all the information you shared. Mom, gonna say something?
No, I want to get ready to clap for
Okay.
it, if that's okay. I could say something all day long, but we know we have a time.
Yes, ma'am. All right, Miss Bagby. Well, thank you so much for coming on. We usually
Thank you.
It's time for us to.
You've been wonderful. You've been wonderful. Yeah, thank you so much. Yeah.
Thank
Thank you so much. We'll get this.
All right.
It usually takes me about 48 hours to, usually 48 hours to get everything back to you, but I'll have it for you, and it'll be up on all the Buckle Up podcast universe with Brandon Rush and Mama Rush. We're on 20 podcast stations.
Oh, wow.
Yeah, we're all over the place. All righty. Thank you so much.
So
Thank
much.
you.
Love
Bye.
you. Bye-bye. Oh, she's just beautiful. I love that.
Yes, ma'am. Thank you so much.